Writing a systematic review requires many people, a lot of time, and often several tools. While using databases such as PubMed to find literature relevant to your research question is obvious, the other tools available to assist with your review may not be as evident. One of the first questions that may arise after deciding to conduct a systematic review is, how do I do this? While there is no one standardized set of guidelines for running and writing a systematic review, there are still various guidelines that can help guide you and ensure that your review is of a high quality. Some of the better known guidelines include those published by Cochrane, the Joanna Briggs Institute, the Institute of Medicine, Campbell Collaboration, and the University of York's Center for Reviews and Dissemination. All of these guidelines are freely available to read online and can be found via a simple Google search or by going directly to the publisher's website. There are also guidelines that you can follow for reporting systematic reviews and documenting your methodology. These take the forms of checklists to check your review against and flowcharts to document your process. Perhaps the most well-known of these is PRISMA, but you can also use the Moose Guidelines or AmStar. Like the previously mentioned guidelines, PRISMA, Moose, and AmStar are freely available online. While databases like PubMed or CINAHL are helpful in finding published articles about your research topic, you may also need to include other types of evidence, such as clinical trials or unpublished literature, also known as gray literature, in your review. There are a large number of resources for locating both clinical trials and gray literature, but some are more commonly used than others. Good resources for clinical trials include clinicaltrials.gov, CenterWatch, the Cochrane Central Register of Controlled Trials, Eli Lilly and Company Clinical Trial Registry, European Union Clinical Trials, the ISRCTN Registry, TRIP, and the WHO International Clinical Trials Registry. All of these are free for anyone to search with the exception of the Cochrane Central Register, which you must access using your Rush credentials. As noted before, gray literature is unpublished literature, including dissertations, theses, conference abstracts, white papers, government reports, and more. Common sources for gray literature include the Gray Literature Report, Oyster, OpenGray, Mednar, and ProQuest dissertations and theses. Of these, only ProQuest database will require your Rush login credentials to access. If you have any further questions about these resources, feel free to reach out to the library via the chat function on the library homepage or via the Ask a Question form.